Okay. Good morning, everyone. We're going to get started here in just a second. You should be able to see the screen, and we'll get this kicked off here in just a few minutes. All right, so let's go ahead and get started. Hopefully everybody can hear me all right. We are going to go through the PowerPoint that you see on your screen and all of the resources available to you from AGC of Washington. So I'll start by saying my name is Mandy Kime. I am the Director of Safety for AGC of Washington and have been working closely with my boss, David DeHant, who is also a panelist on today's call, to address phase one construction concerns with regard to restarting construction. So before we get into today's content, I would just like to say that we've got some ground rules for today's webinar, and I'll go through those before we get into this PowerPoint. A copy of this recording will be emailed out to everybody that participated or even registered for this and wasn't able to participate. So you will get a copy of this via email from our GoToMeeting platform. So some ground rules to start us off. The situation and the global response is evolving rapidly. The information shared here is current as of 10 a.m. on April 27th, 2020, which is today. Your microphones are muted for the ability for us to get through the content, but we do have the opportunity for you to ask us questions. The best way to ask those questions is to use the question feature on your GoToWebinar toolbar should be on the right-hand side of your screen. So many of you have participated in our town halls in the past and have used that question feature, but for those of you that are new to it, you type your question into that feature, and we will either field those questions at the end or respond to you after the webinar, depending on the nature of the question. So also on the right-hand side in your toolbar for this GoToWebinar, I have uploaded 5 handouts, 5 documents off of our website. And so the 5 documents are a COVID symptom check guide, a COVID tips poster that's revised for phase 1, our phase 1 job site practices document, our phase 1 sample plan, and the temperature scan guide. So those are there just for your convenience today. They are also loaded on the AGC of Washington COVID response page, and we'll get to that here in a minute. So feel free to download those either from the handouts pane or going to the AGC of Washington website. The last slide of this presentation has contact information for the presenter and key AGC staff. So feel free to reach out after the webinar if we can be of service. We're trying to make sure that everybody understands what's going on and answer any questions that we can through this medium, but just know that AGC and our staff are here to answer questions as they come up for you as well. So with that, I'm going to go over kind of our plan of attack for today's webinar. So we are going to talk about the COVID-19 phase 1 restart that was announced by the governor on Friday. So you may have seen this morning an email bulletin from our Executive Vice President, David DeHaan, with the addendum to the governor's announcement on Friday. So please feel free to look at those resources via your email, and I will cover those phase one requirements to the best of my ability, as well as the addendum while we go through today's webinar. And if you have problems getting to those documents, we'll happily get those over to you. So we're going to talk about ongoing essential projects. It's been a really big question, and you know what you do for ongoing essential projects as opposed to phase one. We're going to go through the phase one requirements as well as the addendum. And we'll also go through AGC's resource page and all of the documents that I've created for our members to help comply with phase one. We'll talk a little bit about labor and industries consultation and enforcement services. We'll talk about what's next or what we can expect next. And then lastly, we'll go over contact information. So that's kind of the lay of the land for today. My hope is to get through most of this in a fairly timely order to be able to answer questions as needed. And again, if we don't get to all of the questions online today, we will certainly be following up with you in the next day or so to get you solid answers on everything that you have questions about. So with that, let's talk first about ongoing essential projects. So I want to be really clear because a lot of people think that that ongoing essential projects in phase one are completely different, and they are not completely different. Based off of the addendum announced today from the governor, no job site may operate until the contractor can meet and maintain all requirements, including providing materials, schedules, and equipment required to comply. Currently operating, so ongoing essential projects, must be in compliance no later than Friday, May 1st. However, the only exception to those phase one requirements for ongoing essential projects is in the limited instances where you may have to work within 6 feet, you must have done and documented a job hazard analysis and have all your controls in place, meeting CDC, Department of Health, and Labor and Industries requirements. So you do need to comply with everything else in phase one. The biggest question I'm getting is folks saying, well, if I'm an ongoing essential project, do I have to do temperature scans for phase one? And the answer is yes. So making sure that that's as clear as possible. All right, so here's, in a nutshell, the most boiled down version of our phase one requirements. I may or may not have said it, but you have until May 1st. If you're an ongoing essential project, you have until May 1st to be in compliance with all the elements of phase one. So those ongoing essential projects have time, whereby anyone that's starting up work as phase one, you must have all of this in place before you start work. All right, so phase one requirements. There's a couple of signage requirements. You need to post, and we have on our website a COVID tips poster that explains the requirements of phase one. Ooh, great question came up on the line, and I probably should have addressed this, but office staff that are supporting phase one requirements do need to comply with all of these phase one requirements. Phase one is not just for the folks in the field, it's for everybody that's doing phase one work. Okay, so back to phase one requirements. So you need to have signs that post what the requirements are with regard to phase one, what your job site requirements are. So we have a sample poster for that. You also need to have a sign that is posted that says that your job site is starting as a phase one project, who your COVID site supervisor is, how you can contact them, and that you are following phase one requirements. So both of those signs are available on our resource page, which I'll get to in a minute. You also need to have an exposure control plan. I think the exact verbiage on the exposure control plan is that it's called a comprehensive COVID-19 exposure control mitigation, and recovery plan. So we have a sample of that for you. Important thing of note with that document is it's designed to be your accident prevention program element, where it goes over all the things you as a company are going to do for the protection of your workforce from COVID-19. There is also a site safety job site practices guide, as well as a site-specific document that AGC has created that you can fill in. I got feedback this morning, which is fantastic, but I greatly appreciate that some of these documents are in a PDF format and you'd like to have them in a Word format. I am working on that. I just couldn't get it all pulled off before this webinar. So we will be changing those documents to make sure that they are Word documents so you can edit them. And we want to make sure that you guys have them in a format that are most applicable to you. So you do need to have that exposure control plan. Next, you need to designate someone as the COVID-19 site supervisor. Some things that you should note about that COVID site supervisor are that that supervisor can have other duties as long as they're capable of fulfilling their primary duty of being the COVID-19 site supervisor. So that person, that site supervisor, must be on site at all times, and their role is to monitor the health of employees and enforce the COVID-19 job site safety plan. Next, we have the COVID-19 safety training, and we'll get to that resource here in a minute, but AGC filmed a video with Integrity Safety Services last week, and we published that to YouTube, and you are welcome to use that to train all of your staff for the awareness portion of training. So if you look at the governor's phase 1 document, it says you need to do a stand down, toolbox talk, or tailgate training on all job sites on the first day of returning to work, and then at least weekly thereafter. So we have toolbox talks, and we're working on getting more of those published. And the good news is they're going to get published to the AGC of Washington Safety app as well, so you'll have access to them from there, as well as from our website. So in whatever format works for you, feel free to take those documents and utilize them. Social distancing, I want to be really, really clear about phase 1. Phase 1, you must maintain social distancing of 6 feet at all times. There is no provision for intermittent crossing of the 6-foot barrier. That's what we're going to broach when we talk about phase 2. But right now, the governor is very clear on the expectation that phase 1 work must be done with 6-foot social distancing at all times. So if you can't maintain social distancing, you can't be doing the work. I've had a lot of people contact me in the last couple of days saying that, oh, we've got to move, panels of sheetrock, or we've got to do this task or that task, and we're within 6 feet. Well, that's not phase 1 work. That'll be phase 2 work. The only exception to that is if you're in an ongoing essential project that already had your job hazard analysis and controls in place. So there's that. PPE, 100% within the phase 1 document, you need to have masks, eye protection, and gloves. Masks do not have to be N95 or KN95. You can use cloth face covering style masks to satisfy this requirement. Another question we're getting a lot is gloves. So there's certainly concern about gloves and whether or not you have the right type of glove. So here's what I'll say. It says gloves appropriate for the task. So if you are wearing work gloves, then work gloves will suffice. If the task that you are performing does not require gloves, then latex gloves or work gloves would be appropriate. As far as sanitation and cleanliness, moving on from the PPE bubble, sanitation and cleanliness. So we've got to have hand washing stations. And when and if you are not able to have running water for your hand washing stations, you need to engineer some sort of option, whether that is the igloo cooler with water and soap, or purchasing a hand washing station or building your own hand washing station. So make sure that you have the ability for your workforce to wash their hands. For intermittent use, let's say they rub their nose or they touch a tool that someone else has been sharing with them, then it's okay to use sanitation or a sanitizer to fulfill that requirement. And so making sure that you have your sanitation supplies fully stocked, and that's part of the task of your COVID-19 site supervisor, is to go through and make sure that sanitation of high touch areas is taking place, make sure that supplies are stocked, make sure that common use areas are getting the attention that they need, and that hand washing stations are clean and operational and sanitizer is provided where needed. Okay, so another bullet item to go over is employee screening. So that is one area that is somewhat of a surprise to a lot of us, in that it wasn't in the first version of the phase 1 document that was published in the media before the governor's announcement. So I want to be clear on the employee screening. We have a temperature scan guide and a symptom check guide that you can use that were approved, reviewed and approved by Multi-Care Occupational Health, so that you can follow some sort of procedure here for doing temperature scans. Again, this has to be done before you start work. So it is a phase 1 requirement, and if you're starting work as a phase 1 project, then you need to have employee screening in place. So we'll go through some of those requirements. And so lastly, we need to maintain a log of visitors and workers that attend every day. So ideally, we don't want to be sharing pens. We don't want to be sharing devices. A lot of us are using digital means to record our toolbox talks and those kinds of things. That's fantastic, but let's not pass the iPad around or pass the clipboard around and sign in. Let's just have a point person, and that can be your COVID site supervisor, or that can be another person that is designated to do the intake of folks coming into the job. So we've got tons of questions rolling in, and I promise I'm going to get to them. I'm just going to get through all of this contents on this PowerPoint, and as we get to the end of this presentation, we'll certainly start addressing all these questions, but these are great questions, you guys. So if I stumble a little bit in my descriptions of all these things going on, it's because I have my eyes on all the questions coming in, and I just want to make sure that we let you all know I see them, and I'm certainly going to get to them here in a few minutes. All right, so here's a phase 1 resource page for you. It's got my contact information at the top. So if you have any questions, feel free to shoot me an email through that portal, or most of you guys have my email and phone number already. So I'm just going to walk you through all of the different tools that we created for you last week in preparation for phase 1. So first is the exposure prevention, preparedness, and response plan. That's that first bulleted item that I talked about on the last slide. So this is your overarching corporate program on how you're going to deal with COVID. This talks about screening. It talks about what to do with employees if they're positive or suspected positive. So you can basically plug and play this. Again, I said it earlier, but we're working on making all of these into Word documents so you can edit them as you see necessary. So this is your overarching corporate policy. The next item on there is the phase 1 job site safety practices guide. This is your implementation guide for the elements of phase 1 in a job site format. So it's not a corporate policy speak, it's actually just a job site guide. The next program on here is your COVID site specific work plan. So this is actually built like a JHA, where you can take the elements of the document above, that job site safety practices guide, and fill in the areas where you are where you have exposures or where you have program elements, and what your specific job site expectations are for everybody. So that site-specific work plan is a great tool and something that you can then fill in and post on the job site to communicate what the expectations are. All right, site supervisor responsibilities flyer. So one of the things that is required is having this COVID site supervisor. We are working on building a PowerPoint training program that you can play as a video from our website. My hope is to have that out for you guys tomorrow. Just a lot of content had to be developed in a very short period of time. So if you need to get somebody trained up on site supervisor responsibilities, this flyer or Word document you can utilize for that purpose, and just know that we're going to have a PowerPoint training that can get you taken care of as far as their training as well. So next up we have a health screening memo. This is just a document actually originally produced from the Society for Human Resource Management, and we tweaked it to fit our phase 1 requirements. So this is just a memo to notify your team, your employees, of the fact that temperature screening, health screening is now required by the governor in order for us to commence work. So you can use that as a notification piece and just let your folks know how you're going to be handling the documentation, etc. So I would encourage you to use that as just a heads up to your team. Then we have the temperature screening guide and the symptom screening guide that were both reviewed and approved by Multi-Care Occupational Health. And we'll go over those. I actually have them on the next screen. Also, we have our COVID-19 awareness training video. This is about an 8-minute YouTube video. You are welcome to send this out via email to all of your people and have them watch it prior to starting work so that you have some at least initial awareness training. And next we have our toolbox talk. That's just a simple toolbox talk, and I just want to let everybody know I have about 8 more toolbox talks that I am just working on reformatting so that they will fit, and then those will get shipped off to our folks at safetymeetingapp.com, where we have AGC's safety meeting app, and those will get uploaded there, so you can do them from your phones as well. You are welcome, I should have probably said this at the very beginning, you are welcome to take any of this material, modify it for your use. So if these toolbox talks work great and you have an internal process for digitally handling your toolbox talks, feel free to upload those into your library. All of this was created for you, for your use. So please feel free to, as we say in safety, R&D, rip off and duplicate. So it's all yours. All right, so next we have our job site safety tips poster, and I've got a screen grab of that later in this presentation. So this satisfies the requirement to visibly post your job site's safety protocols. And next we have the job site compliance poster, and that poster satisfies the requirement to post the information that you are a phase 1 job site and identify your COVID site supervisor. So we'll just go ahead and start looking at some of these resources a little more closely. So on your screen now, you have both of our health screen documents, and I'm going to say really clearly, please don't go through the effort of documenting all of this unless someone comes back with a positive with regard to symptoms or comes back hot with regard to temperature. You don't need to create all of this level of documentation. And it just opens up a lot more requirements for you as an employer as far as privacy and those kinds of things. So your full screening process, temperature scan and symptom screening, needs to be done in a private manner. And that means putting up privacy screens if you need to make sure that the next person in line isn't overhearing or seeing anything that could jeopardize somebody's privacy. So we'll start with temperature scan. One of the questions that we've been hearing a lot is, can employees self-report their temperatures? Can they do their own self-monitoring and just tell their supervisor? And the reality is the supervisor or whoever's doing that temperature scan needs to actually see the number. So that could be an employee bringing their own thermometer from home and documenting that by showing the thermometer results to the supervisor. But it's not just a, hey, I took my temperature at home, here's a picture of my thermometer, et cetera, et cetera. I think I want to also clarify that right now, phase 1 does allow you to do a contact thermometer or a non-contact thermometer. We know, and we're very well aware of the fact that you can't find thermometers. We're very well aware of the fact that temperature screens can be inconsistent. So if you have somebody come up higher than 100.4, obviously you're going to want to do some additional screens and average them out. Noting that eating, drinking, doing exercise, standing outside, all of these things in the last 30 minutes before your temperature screen could impact the results of your temperature scan. So that's why it's important if somebody comes in higher than 100.4 that you separate them, isolate them privately to have further discussions and investigation with them, and take some more temperature screens. Sorry, I'm seeing lots of questions on visitor screens and temperature checks. I'll try to get to all of this while we're still on this screen. Temperature checkers on phase 1 projects expected to maintain 6-foot social distancing. Obviously, in order to do the temperature scan, you're going to have to encroach on the 6-foot social distancing, and because of that, your temperature checkers need to have the proper PPE, and you need to address what PPE and sanitation practices they're going to be using between each screenee. And yes, I agree, those two rules do seem to be conflicting, but we're going to make the best of the situation as it is. Hygiene facilities need to be located near screening locations so that if there is contact or someone has an elevated temperature scan, something along those lines, you can go wash your hands, etc. And so as you can see on the temperature scan guide, if the average temperature is still above the fever threshold, regardless of the symptoms, the worker needs to be sent home and asked to consult a healthcare professional. Again, that first document on our landing page, so I'll go back to that. The Exposure Prevention, Preparedness, and Response Plan, page 7 and 8, I believe are the page numbers. They're all running together at this point, but I believe it's page 7 and 8. Those cover the requirements for a job site positive or suspected positive. Again, only record and document temperatures if someone is elevated above the fever threshold or says that they says yes to questions 2 through 6 on your symptom screening guide. And otherwise, you don't want to be documenting all of this. This creates a paperwork nightmare. So there you have it. Those are health screens. I know there's a lot of questions on health screens, and I will address those after we get through a little bit more content. So here's safety training. So the link here on your screen will take you directly to AGC's awareness training video, 8 minutes on YouTube. You can send that out or share it however best suits you. We purposefully developed the scripting on this video to make sure that it meets all the requirements of phase 1, but also can be utilized for general awareness training. So hopefully that serves you well. At last check on our YouTube page, we had, I think, 400 views of the video, so it's getting out there and people are using it, which is great news. Also, we have the weekly toolbox talks. There's one already up there, and more documents should be added later today, and then all of those are going to be uploaded to the AGC Safety app. Also, I'm working with the developer of our safety app, the AGC Safety from safetymeetingapp.com. I'm working with him, and he is trying to help us develop a free version of the Toolbox app for our members for compliance with COVID-19 requirements. Getting a couple people saying that the phase 1 sample plan for COVID-19 does not work. So I will do some IT checking on that as soon as I can when this call is over, so we can get that fixed for you guys. My apologies, it's not working. Okay, so here's your job site postings. So the poster on your left is our job site practices. This is just a reminder for all on what the requirements are. So employers are responsible for social distancing, and employees are responsible for the items in the blue box as far as prevention of transmission. And so these are available to be printed on your job sites and posted wherever you need to post them. And obviously you want to have this up at the entrance to your job site, as well as in any area where employees congregate or might pass by it daily, just as a good reminder. The governor's orders did require that there be a job site posting saying that you will adhere to phase 1 job site safety practices. So that's what this posting on the right-hand side of your screen is. It also requires that you identify who the COVID-19 site supervisor is and how you can reach them. So make sure that this, along with your site-specific and this job site practices, are all posted at the entrance to the job, as well as places where you can use it as a good reminder to your employees. Okay, so that being said, that's a lot of compliance information. There's tons of questions still. I have a couple more slides, and then we will get to as many of these questions as possible. Just know there's a lot of questions popping up, so I'll do my best to hit all of them. So first and foremost, Labor and Industries is at the table helping to develop the content of this phased-in approach to the construction restart. And one of the things that we have heard back is that their industrial hygienists working in consultation are underutilized right now. So that is a free service from the Department of Labor and Industries. So I put the link on your screen for how to contact your local consultation manager. But if you go to lni.wa.gov and type in consultation, it will take you to this page, and you can find the phone number for the regional consultation managers, and you can request a consultation. It's free, and the other advantage to it is you're going to get good compliance advice, but you're also going to show your team that you are doing your level best to provide a safe and healthful work environment. So I encourage you to avail yourself of that service. Compliance is still working. They are still performing inspections. However, all of the COVID complaints are supposed to still be going through the central office. And most of those, excuse me, most of those are being handled via phone triage at this point in time. And so in my talks with the department, what I've been told by multiple folks working there is that the complaint comes in, it goes to the central office, and then that is dispatched out to the regional office, and the regional office calls and goes through a series of questions asking about protections in place and what's going on. And if compliance has a reasonable understanding that the employer is following, the guidelines of the governor and the Department of Labor and Industries, then they are not going out to do inspections. Obviously, it creates an exposure issue for the department staff as well. So they're trying to minimize the amount of time that they're out in the fields in contact. So, but I can't stress this enough with regard to compliance. We consider it a major win that that the governor is allowing construction to go back to work under phase 1. But if we mess this up, it's a simple stroke of a pen that will take away our ability in construction to be working right now. So it was a monumental amount of work on the part of David DeHont, our executive vice president, as well as many others on the governor's roundtable. So it's really important that we adhere to all of these requirements. But I will tell you also, as we learned from our L&I town hall a couple weeks ago, that the vast majority of complaints that are getting called in either to the governor's office or directly to Labor and Industries are not being inspected because they're able to be handled with a phone triage and phone consultation. So I don't want everybody to be afraid that you've got L&I inspectors sitting outside your job site waiting for you to make one mistake on a temperature screen or something along those lines. But I want to be clear that that's not a free license for us to just go out and do work however we feel like doing it. So we've got to be thoughtful, and that's why AGC worked so incredibly hard over the last week to develop resources that will help you as much as possible. So avail yourself of consultation and compliance. So let's talk about what's next. Like I said, we've got to do phase 1 well in order to have phase 2 even happen. So following those requirements is important. Phase 2 draft for the governor's office is in progress right now, and we're hoping to have it to the governor this week. We're waiting on Labor and Industries, which is important information that we really can't move without them providing that. So we're still waiting. For those of you that have been calling me over the last week, we're still waiting. So we are hopeful that we will get it anytime. Hopefully today would be fantastic. But all of that aside, even once we get all of that information and we have that draft ready for the governor, it's really still the governor's call, and the governor is going to temper that decision against how things are being run presently under phase 1. It's going to be tempered against Department of Health statistics on whether or not we've had an uptick in construction cases. And I will tell you, I think that we're doing a fantastic job. So my hat's off to all of you out there that have been doing ongoing essential projects. Truly phenomenal job that you all are doing. We don't want to be like agriculture, and I'll give you a great case. There's a case in East Wenatchee right now in agriculture where 71 workers were tested, and over 30 of those workers were positive, and some of those positives were asymptomatic. So we don't want to have that be the outcome of us starting up a phase 1. So if you are, doing phase 1 work and you have a positive, we got to treat it seriously, and we got to, take care of everyone and make sure that our job sites are sanitized and that we're following all of the protocols. So we just seriously don't want to have the bad PR, nor do we want to have the outbreak that we're seeing in some agriculture cases lately. So also, as you can see in the red bar across the bottom of your screen, we've been assembling a list of providers of services and supplies that you may need. I've been sending that out as people have been contacting me. But we've got providers with sanitizer, and actually today we found out that there's a local provider that has about 30,000 KN95 masks. So if you're in need of those, shoot me an email and we'll get that communicated out to you. As well as sanitation services, there's different providers that can do that. So a couple of questions that just popped up. To be clear, someone says, to be clear, only essential work is on phase one. No, ongoing essential projects can continue. They need to follow the phase one guidelines, with the exception of essential projects that have been ongoing prior to the governor's announcement can encroach on the 6-foot limit as long as they have a job hazard analysis and controls in place for that work. Phase one is another section of work that can open effective immediately. And that section of work has to follow all of the requirements of phase one and must be in place before you start the work. So everything that we reviewed today as far as phase one has to be in place before you start that work. Ongoing essential projects have until May 1st. So with that, I'm going to leave contact information up on the screen for all of you. And I'm going to attempt to start answering some of these questions as quickly as I can, just so that we get as many of them handled while we're still on this call. So is there still a 50-person limit? No. The phase one is not related to the number of persons. It's related to you having hazard controls in place and maintaining 6 feet of social distancing consistently 100% of the time. Can multiple people on site be named site supervisor and rotate site inspections? Yes. But if you do that, you need to call out who they are on your signage so that everybody knows, and so everybody knows who to contact if they have concerns. Okay. What is the subcontractor's responsibility with signage? It would be the same as if you were any other requirements on the job. You can rely on the general contractor to provide that signage, but if they're not doing it, then you need to do it. Where can we find the regulation stating that essential projects have till May 1st to be in compliance? That is an addendum sent out by the governor today that is posted on our website, and it went out via email from my boss, David DeHont, in a memo this morning. But all of our memos and bulletins are posted to that COVID page. So if you have problems finding it, let me know, and we'll happily send that to you. All of this job site information is posted to the agency's website. Yes, the landing platform is there, and 5 of the documents are actually uploaded to this webinar platform as well. Lead on thermometers. I wish we had a great lead on thermometers. We're still working on that. And as soon as we find out any other leads on thermometers, we'll certainly be sending that out, sharing with folks. So the GC's COVID plan is sufficient so long as the project is following it. Yes, I would make sure contractually you as the general contractor are making sure that folks are complying with it. And I would make sure that you have communicated through all mediums to your subcontractors that it is their responsibility to comply with your site COVID plan. What are the PPE and temperature screening requirements for our office staff? It's all the same. If you are supporting phase one work, then you fall in phase one requirements, which means your PPE and temperature screening must be done, just like the job site people. It's not, there's no differentiation between what work is being performed under phase one. If you're supporting phase one, you need to follow those steps. Who's required to perform the temperature scans, the GC or the sub employer? It just has to be done. Has to be done. So you can work that out between the GC and the sub as far as who wants to perform that work for their own employees. But I would also say another thing that we've had a lot of people asking questions about with regard to the temperature scans is, does it have to be a medical professional? Does it have to be a professional that's trained or qualified somehow medically? No, they're not doing health surveillance. They're taking a temperature, and so they need to be trained on the manufacturer specifications of that thermometer. They need to be trained on the disinfection protocols for that thermometer, and they need to be trained on the PPE that they need to wear, so that they are fully prepared to perform that work. I've gotten 2 emails or 2 messages on here. Mallory Safety and Supply appears to have non-contact thermometers at roughly $130 a piece. And scrolling up for the other one, iHealthLabs.com also appears to have thermometers. I have not vetted either of these. They're just comments that people have made, and I want to get them out to you guys. So yes, you need to ensure that all your subs have a COVID plan. It's a requirement, period. Okay, so let me get back down here because I had a question about the YouTube training link. John, I see your comment here. I'm going to scroll back. It was on an earlier slide here for your, so there you have it there on the safety training. There's the direct YouTube link, and I know that that's really hard to type in. So I'm going to navigate you back to a page where you can find everything. When you go to the AGC of Washington website and you click on our COVID page, at the top it says, are you looking for phase 1 recovery resource page? Click on that. If you click on that, you're going to end up on this landing page here that you see on your screen. And about midway down, it says COVID-19 awareness training video, and that'll take you directly to the YouTube link to use that video. The first thermometer source, Michael, I see your comment. The first thermometer source is Mallory Safety and Supply. And it says here that they're running roughly $130 each. Okay, so let me scroll up and get to some of these questions. There's an abundance of questions, so I'm going to do my best to get through them. Still have a few minutes, so that's good. And if you have more questions, feel free to ask. Even if I don't get to your question online today, we will send follow-up communication to all members based off of the content that we get here via this question feature. So yes, we are aware that the sample plan is not downloading properly. We will get that fixed. Applicability of this order to federal projects. If you're performing work in Washington State, is my understanding that you have to follow phase 1. I know Dave is on this call. Maybe he can weigh in. Let's see if I can force him his mic live.
I'm here.
Cool. There you are.
So I'll have to get back, and you'll have to post that. I'm not sure. A lot of the federal projects have their own requirements.
Okay, thanks, Dave. Hey, look at that, you guys. We're using technology. We can all talk at the same time now. Well, at least me and Dave can. You're still muted. Sorry. Okay, can the AGC provide an all-in-one type poster template that will meet the criteria of the phase 1 requirements? We don't have it as an all-in-one because some parts of this are editable to meet your site requirements, and some of them are multi-page documents. So we've provided everything. You just need to then edit it as necessary and post it. Will the general contractor be responsible for taking temperatures of subcontractors, or can we require the subs to report their temperature taking to the general? Yes, you can require your subs to do their own temperature scans as long as they're following the same protocols and that they have a mechanism for dealing with people that say yes to the symptoms or test positive for a fever. We covered temperature scanners. Who is required to perform the temp scans? GCR sub, we talked about that. And the individual that does it just has to be trained per the manufacturer specifications on the thermometer itself, on sanitation protocols, and on the PPE that they're required to wear.
Hey, Mandy?
Yeah.
So on that, Dr. Weissman, who's the head of the Washington State Department of Health, has suggested that it be the COVID supervisor.
So yes, it has been suggested that it's the COVID supervisor, as David said, but I also understand that there's some job sites where you have enough people on the job where that would take a while. So you can have help with that process for sure. Just make sure that you follow the symptom screens. Do the office staff need to be screened? Yes. Everyone performing work supporting phase 1 needs to follow phase 1 guidelines. Do you have any info on the PPE availability outlook yet for situations where social physical distancing is not always possible? So first answer to that question is anything where you can't maintain the social distancing is technically phase 2 unless you're on an ongoing essential project. And we are continually trying to source PPE availability. We have a potential lead from emergency management on a very large quantity of cloth face masks. And so if you're looking for cloth face masks, please let us know. And we'll work with you to try to supply those. And then also, like I said earlier, we do have one agency contact that has a large supply of KN95 masks for purchase. So we're going to update that on our supplier list. 50% limit, we already talked about. Office staff need to wear PPE in their offices. Yes, they are, like I said, they are required to follow phase 1. Does the restart poster need to be posted at a main office building that is offsite of a project? Well, if it's in support of phase 1, and that's the reason why people are working in that main office building, then absolutely they need to know what the phase 1 requirements are and who the site specific COVID supervisor is. Yes, I've had a lot of people ask this question, and I know that you're probably going to get pushback from your folks in the office about wearing masks and safety glasses and gloves while typing at their desk, but technically that's what the phase 1 requirement says. Okay. So many questions to scroll through. I'm trying. Okay, the L&I document linked in the phase 1 order has hard plastic face shields as acceptable PPE as well as cloth masks. This document reads as an either or requirement. The new phase 1 order only mentions cloth masks, but then links back to this document with multiple options. So what I will tell you is, again, we are waiting on clarification from Labor and Industries with regard to acceptable PPE, but for now, the phase 1 order does specifically say masks. I'm going to let Dave weigh in and see if he has anything more to add to that end.
So we got to wait from L&I, and that's the easiest way to say it. I think that you'll see actually an easing.
Correct. Thank you, Dave. Yes, every job needs to do temperature scans, even those that are essential projects. Essential projects have until May 1st to add that to their repertoire. Yes, you can have more than one COVID site supervisor as long as that's clearly communicated and posted. Subs can rely on the GC COVID site supervisor as long as that's arranged and communicated ahead of time and the COVID site supervisor knows their role and capacity and authority. COVID site supervisors can perform other functions. Question about working on small vessels and dive boats. Spencer, I'm going to have to get back to you offline on that because I'm not sure. I'm going to need a little bit more detail from you on that. Obviously, if it's supporting construction phase 1, we'll talk through it. Okay. Is it considered social distancing when we are within 6 feet but have a physical barrier between the people? If you have a barrier that's an engineering control that eliminates the hazard, then I believe that would work for essential projects, but there is no provision in phase 1 to allow for work within 6 feet, even with a physical barrier. Dave, correct me if I'm wrong.
That's correct.
Thank you. Does the phase 1 plan supersede an ongoing essential project already underway with its already developed safety plan? Great question. Yes. The only exception to that is encroachment within the 6 feet, but you must have an already developed safety plan and protocols in place. And I've had a lot of people go, well, I have an essential project that was slated to start on Monday, April 27th. So are we essential or are we phase 1? And I'm going to tell you that for all intents and purposes, if it was not an ongoing essential project prior to the governor's orders, it's not an ongoing essential project. It is kind of a part of this phase 1 restart. Okay, signage we've talked about. So for mobile operations, like service operations, where somebody is going to multiple sites that may not already be controlled by a general contractor, as far as signage, I would say you need to make sure that your employees know what the requirements are. And if they're going to multiple locations per day and they're not setting up shop there, that as long as you have your all of your protocols for phase 1 in place, that you wouldn't necessarily have to post signage at your customer's location. That's about office staff wearing PPE. So are we as subcontractors required to supply the COVID-19 designated supervisor? Not necessarily, but if it's not provided by the general contractor, then you absolutely need to provide your own COVID site supervisor. Are masks required for people in a cab, such as dump truck or a piece of equipment? Yep, that's part of phase 1. 100% of phase 1 has PPE requirements. And I, like Dave mentioned earlier, we anticipate a softening or an ease of requirements as we get into phase 2. And like I mentioned earlier, the hope is to get the phase 2 document to the governor this week. And our hope is that we've done a great job with essential projects and that we will do a great job with phase 1 and we'll be able to be a great model for the governor on how we move forward, and that would mean that the phase 2 would not sit around and collect dust for very long. Phase 1 requirements. The site supervisor paragraph states that the end, except this requirement only applies on single-family residential job sites whenever there are 7 or more people on the site. So all projects need to have a designated COVID-19 site supervisor, except single-family residential job sites below 7. If that makes sense. The wording of it is somewhat confusing, but basically they're giving a provision that if you're on a residential job site and you have less than 7 people working on that job site, you don't have to have the COVID site supervisor, but everything else still applies. As quickly as I answer them, the questions are coming in. So we're certainly going to have to do some follow-up because we're almost out of time. So I'll do a couple more questions, and then maybe if Dave has any closing comments, we can do that as well. If our jobs have been ongoing with measures to protect, can we continue to do so? Yes, those operations don't need to stop. You have until May 1st to come into compliance. Temp scans are at the start of each day. That's not just a pre-screening once, it's a daily temp scan. Does a truck driver who does not get out of his truck need to be temperature tested? All parts of phase 1 apply to phase 1 work. I know that's probably not the answer you want to see. All right, so with that, like I said, there's literally, I think, over 100 questions that I have not gotten to. I'm sure a lot of them are duplicative. So I'm going to do my level best to get through as many of these questions today and send out follow-up communications to all of you. But let me just close by saying a few closing remarks, and then I'll let David speak if he's got anything else to add. But first and foremost, AGC's job is to support you through this. I know that some of this is a curveball. I know that it's hard, and we are doing our level best at AGC to support you through this. I have worked pretty hard to get all of these phase 1 documents up and ready for you as quickly as humanly possible, but know that there's more things in the works. Our site supervisor responsibilities training is coming. More toolbox talks are coming. A new free COVID safety app is coming. We're doing our best, and as things change and as they update, we're going to continue to communicate with you. Please don't hesitate to reach out to me via email or phone. I'm looking at my phone right now, and just since we've been on this call, I've gotten 47 emails. So I'm trying, and I'll do my best to get to every one of those questions as quickly as I possibly can. And just know that we are here for you, and we understand your concerns and the frustrations involved in trying to comply with this ever-changing set of circumstances. Please avail yourself of the contact information on the screen. Myself, David DeHaan, our Executive Vice President, who is on the Governor's Roundtable. Andrew Ledbetter, our Director of Labor Relations, has been working really hard on the HR side of the House to make sure that all of our HR questions are answered. Jerry, our Chief Lobbyist, as well as his team in Olympia, have been working to iron out some of these wrinkles as well. And then all 3 of our district managers' contact information are on your screen. But I will tell you, we all know and understand how difficult this is to keep up with, and we're here for you, and we'll answer your questions as much as we're able to. And we're doing our best to source resources, supplies, and tools to help you get through this unprecedented time. And I, as a safety professional, I can identify with the amount of stress and sheer chaos that you all are managing. So at the end of the day, please look out for yourselves too. This is hard times. And I'd be remiss if I didn't say today is the 1-year anniversary of the crane accident in Seattle. Also hard times. And so just know that we we are in this together. And if you need resources on mental health, we have those as well. But my challenge to each of you as safety professionals and people managing this crisis internally with your companies is to take time for yourself, for your mental health, and work on creating a little bit of peace for yourself so that you can recoup and respond as necessary. So I appreciate all of you, and I appreciate the opportunity of getting to work for you guys every day. So with that, I'll turn it over to Dave and see if he's got anything to add.
Great job, Andy. Thanks. I just want to make sure that everybody knows how thankful we are having all as AGC members. And while, as Menji mentioned, it's not necessarily easy to do some of these requirements, at least we have the opportunity to start again. So everybody be safe out there, and as Mandy mentioned, we'll try and get back all the answers to questions as soon as we can. And my final comment would be that truck driver coming in on the site, we asked this question in the roundtable. If they're not going to get out of the truck, then there's no reason to have them open a window or take their temperature or do anything like that. And again, thanks everybody.
Thanks, Dave. For all of you on the phone, Dave's put in some crazy long hours trying to represent our industry for the Governor's Roundtable. So hats off to him for all that effort. So you will get a copy of this recording. I changed the settings to have it go out as soon as the video is fully uploaded to the GoToMeeting servers. So it should be a few hours instead of a full day or two as the default is. So you will get a recording of this, and we will get to work on fixing the resource page and make sure that all those documents do truly download. The job site practices and sample plan are uploaded as handouts in this webinar. So if you want to grab those real quick before I end the webinar, that's probably a great idea. And we appreciate your patience as we navigate through all these questions and try to get responses back to you. So thank you so much for your attendance, and have a wonderfully safe day.